Welcome and thank you for standing by. At this time, all participants are in listen-only mode until the question and answer session of today's call. At that time, if you'd like to ask a question, please press star one. Today's conference is being recorded. If you have any objections, you may disconnect at this time. I would now like to turn the meeting over to Claudine Cavanaugh. Thank you, and you may begin.
Hello, good afternoon, everyone, and thank you for joining today's webinar. My name is Claudine Cavanaugh, and I'm a Senior Advisor for Nutrition and Policy at the Food and Drug Administration, and I'll be moderating today's session. We want to thank everyone for their patience. There were a lot of people trying to get on at the last minute, so we wanted to delay the start to have as many people join the call as possible. The purpose of today's webinar is to provide an overview of FDA's updated nutrition facts label in a bit more detail now that we've had about a month or so to review the rules. If you haven't done so already, please make sure that you've logged into the My Meetings link so that you can view the slides as we present them today. If for some reason you're having technical difficulty logging into My Meetings, we also have the slides available on the FDA website, and that would be at www.fda.gov/food/news events/workshops, meetings, and conferences. Also, if you go to FDA's page that says Changes to the Nutrition Facts Label, which is easily accessed from Google, you can get to the webinar and the slides from there as well. Today we are very glad to have two speakers, Dr. Susan Main, who is the Director of FDA's Center for Food Safety and Applied Nutrition, and we also have Dr. Douglas Ballantyne, who is the Director of CFDA's Office of Nutrition, Foods, and Labeling. Also joining us on the call today are many FDA technical experts that will be available for the Q&A section. After the presentation, we will have the Q&A session. So I'm going to, at this time, I'm going to turn our call over to our first speaker, Dr. Susan Main. Susan?
Thank you, Claudine. I want to add my welcome to the audience, and thanks for joining us today. As Claudine noted, it's been exactly 1 month since we issued final rules to update the nutrition facts label. I hope you've had the opportunity to become familiar with the new requirements. We know there is a lot of information on the final rules, and today is an opportunity for us to review the requirements with you and to provide a bit more detail than we did when the rules were released. I will leave that part of the presentation to Dr. Ballantyne and the other experts we have here today, but I wanted to say a few words about the importance of education in making the new nutrition facts label a success. Of course, consumers will be the ones using the label most often, and we need to help them understand how to use the new information that will be appearing on the label. For example, consumers will need to know how to interpret the new information on added sugars in the context of the total label. We also know that the public often has difficulty in understanding daily values. The new footnote should help, but education is needed as well. And we will need to help consumers understand why we are now requiring vitamin D and potassium to be added to the label. Consumers aren't the only ones who need to understand the changes. Professionals, such as physicians and dietitians, need to be prepared to help their patients make food choices that are appropriate for their specific needs. Just last week, FDA announced, in collaboration with the American Medical Association, a continuing medical education video for physicians about how they can help their patients make better use of the nutrition facts label. The FDA will be developing a number of educational materials as we transition to the new label, and we will target our efforts to the needs of diverse populations. But we can't do this job alone. We need help in spreading the word, and we'll be seeking partnerships with organizations that have a common interest in nutrition labeling education. In fact, we have already been approached by potential partners, and we encourage others to let us know of your interest. Manufacturers will need a different type of assistance, and we will be doing what we can to help them to comply with the new requirements. For example, we will be issuing 2 guidance documents, one that provides more detail on the labeling requirements to help industry comply with the new label, and another one on fiber. The first guidance will address questions we have been receiving from the industry, including issues related to the compliance date, and how to qualify for the extra year of compliance for businesses with less than $10 million in revenue. The guidance on fiber will provide information on the scientific approach the agency plans to use in evaluating the health benefits of different fibers and deciding whether their amounts can be declared on the label. We also will be making a number of presentations and meeting with groups who request more information. And an email address has been established for questions you may have, and we will share that with you during the presentation. An important part of this educational effort is making sure that our stakeholders understand the new requirements. So with that, I will turn the discussion over to Dr. Ballantyne, the Director of our Office of Nutrition and Food Labeling.
Thank you, Dr. Main, and welcome all. It's my pleasure to take you through an overview of the new rules for the nutrition facts panels and the update to the serving size regulation. Just to put the new regulations into context, I just wanted to refresh all of your memories that the regulations governing the nutrition facts panel and serving sizes was established back in 1990 as part of the Nutrition Labeling and Education Act. This particular act gave the FDA the explicit authority to establish nutrition labeling guidelines. It required the disclosure of specific nutrients on the nutrition facts panel. It gave us authority to add and remove certain nutrients that are required to be declared on the label in order to address public health needs. And it required that some information be put into context of the daily diet, as the label is designed to help consumers make informed food choices. Why was it this time that we should be updating the nutrition facts label? It's been over 20 years since the last update to the nutrition facts label was made, with the exception of adding the requirement for declaring trans fat on the nutrition facts label back in 2006. There was a need to update the label as a lot of new science has emerged in the recent years, changing our views on the links between diet and public health needs, such as cardiovascular disease, obesity, blood pressure, and stroke. So there was a need to update the information in the nutrition facts panel to reflect these changes in the understanding of consumer and public health science. People have changed how they're eating, and portion sizes have changed as industry has changed packaging sizes. So there was a need to update serving sizes, and thus the amount of calories and nutrients that go with them to bring them into date with what consumers are eating today. We also needed to change dietary guidance as that serving sizes and packaging has changed even more, so that many packages are larger in serving size than they were in the past. There was a long and extensive regulatory process that was undertaken in order to update this, so that there was significant public comment and input provided into the final rule. The regulatory process started back in 2002 with 4 ANPRMs, or announcement of proposed rulemaking. The feedback we got as part of that initial rulemaking questioning led back to 2 proposed rules that were issued in March of 2014. That started the formal regulatory process, and we received much public comment as a result of those proposed rules. In July of 2015, a supplement to the proposed rule was put out, specifically related to the inclusion of added sugars into the nutrition facts panel, and a follow-up to specifically ask questions about establishing a daily value for added sugars. Furthermore, there was additional discussion about changes to the footnote on the nutrition facts label. Through the regulatory process, we received over 300,000 comments that were addressed as part of us formalizing and updating the rule, and the 2 rules were finally published in May 27th of 2016. Next slide. Just wanted to put in context the purpose of the nutrition facts label on general food products. The nutrition facts table is targeted at the general population, age 4 years of age and older, including those at risk for chronic disease, but not specifically focused on those who have chronic diseases. Those at risk include people who are overweight and obese, which represents about 2/3 of adults in the United States today. As I said, the label is not meant to treat or deal with specific illnesses or chronic diseases. The label is also not looking at pregnant and lactating women, as they have different daily values. So we've established sections in the rule for young children, ages 1 to 3, and infants through 12 months of age. Next slide. There was a lot of input and information that was taken into account as part of coming to the final rules. Scientific evidence, including consensus reports, public comments to the advance notices of proposed rulemaking, citizens petitions from manufacturers, advocacy groups, and individuals, data from national health and national examination surveys, or NHANES, and findings from a variety of consumer studies. Some of those were done by FDA and others provided through the comment period. So a variety of input and information were all taken into account as part of finalizing the rules. Next slide. Now I'd like to provide an overview of some of the key changes that happened as part of the rule. And as part of that, I want to remind everybody that there are elements of the nutrition facts rule that are in the CFR that guides where nutrition facts labels are placed on packages, and some other elements of execution that weren't changed by the final rule but should be continued to be followed as part of implementing the new nutrition facts label. So some of the key changes were, we now mandated the declaration of added sugars with a prevent TV. We modernized the format to highlight calories and serving size information. There was an updated footnote. Daily values were updated to reflect the recent scientific information found in reports of the IOM and some information coming from the science behind dietary guidelines for Americans. Nutrients of public health concern and significance have changed over the years as America's dietary patterns and intakes have shifted, and therefore we adjusted the nutrition facts label to take those changes into account. There were adjustments to trans fat and dietary fiber, and for the first time there was a record-keeping requirement that was added into the rule in order for us to be able to determine whether there was compliance with the rules. Next slide. There were changes in the reference amounts used to calculate serving sizes. There was a requirement for dual column labeling with nutrition information listed both as per serving and per package for certain products. There was changes in the criteria for single serving packages, and we introduced a compliance date. Next slide. I'd now like to just briefly provide the highlights of the changes in the nutrition facts label before I go into the details of each of those changes. So you first note that the iconic look of the nutrition facts panel was not changed from the previous nutrition facts panel. So it has an updated and modern feel, but the basic elements of the label remain the same. However, I wanted to bring to your attention the clear focus on serving size. Servings were changed to be right below servings per container and in bold. And calories were highlighted specifically to help Americans as they look to control their weight and calories to be aware of the serving size they're consuming and the number of calories consuming per container and per serving. There was an establishment of updated daily values. So, for example, we changed the daily value for total fat. There was an updating of daily values for sodium to reflect the 2,300 milligrams in the more recent IOM reports and dietary guidelines. and there was a change in daily values for calcium and vitamin D. There was also a change that in the declarations in the nutrition facts panel, so not only would nutrients be declared with daily value, but they'd be declared with milligram or unit amounts to make it easier for consumers to know what both the amounts and the percent daily value they're getting in a particular serving of a food. Added sugars were added for the first time, and as I said before, changes in the nutrients required were modified to adjust those nutrients of public health needs. So now vitamin D and calcium and potassium are required as mandatory elements in the nutrition facts panel, while calcium and iron are still retained from the old label. However, other nutrients that previously been declared can be declared on a voluntary basis. We also updated the footnote to help consumers better understand how the nutrition facts panel should be used in the context of a daily diet. Next slide. I'll now go over some of the major elements in more detail. So I'd like to start with added sugars. Scientific evidence clearly has shown us that added sugars in the diet is of a public health significance. High intake of added sugars decreases intake of other nutrient-dense foods and increases the overall intake of calories in the diet, making it difficult for consumers to get their nutrients of need while maintaining calorie balance. Dietary patterns lower in sugar-sweetened foods and beverages are associated with a reduced risk of coronary vascular disease. As diet modeling is done, meeting nutrient needs from foods while staying within calorie limits is extremely difficult with more than 10% of total daily calories from added sugars. So for these three fundamental reasons, we felt we had the public health basis to add added sugars into the nutrition facts panel. Next slide. So in modifying the nutrition facts panel, added sugars was included to help clarify, includes was added before added sugars to help clarify that added sugars is a subcomponent of total sugars. We also modified the hairline between total sugars and added sugars to make it clear that added sugars is a subcomponent of total sugars rather than a separate amount of sugar in individual products. So we've made these changes based on consumer information and other input that we felt was necessary to help clarify how added sugars played a role within total sugars in food products. Next slide. So what are the types of products or types of ingredients that are included within the definition of added sugars? Added sugars include sugars that are added during processing of foods and or are packaged as such. And these include a variety of typical products that you would expect to have sugars, such as syrups, brown sugar, high fructose corn syrup, invert sugar, maltose, trehalose, honey, molasses, sucrose, lactose, maltose sugar, and concentrated fruit juice, to name a few. So added sugars can come from a variety of sources. So when sugars from concentrated fruit juices or fruit purees are added as part of sweetening agents, those products, when they're in excess of those that would normally be expected to come from fruit or fruit juice, are also considered to be added sugars in these particular products. And as part of going forward in our guidance, we'll be providing more detailed information on how you determine added sugars in food products. Next slide. The next thing I'd like to highlight is the changes in calories and serving sizes. As part of helping consumers manage caloric intake, there was a need to focus attention on information that's important for addressing the current public health problems like obesity. Therefore, we increased the font size of calories and the font size of servings per containers and the serving size declaration to make it easier for consumers to see that particular information within the nutrition facts panel. We've also reversed the order of serving size and serving per container to make it clear that serving size and calories are related to one another. We expect that these changes will make it easier for consumers to recognize the servings that they're consuming from a particular food and the calories per portion in those particular food products, helping them to maintain more caloric balance. Next slide. We've also updated the footnote with a modernized expression to help consumers understand in a simpler way how percent daily value helps put calories into context and each of the nutrients in context with healthy diet patterns. This same statement is similar to those statements that will be used in menu labeling, where they'll be seeing the same sort of information when they go to restaurants and get calorie information on menu boards in restaurants throughout the country as that information becomes mandatory over the next year. Next slide. Updating the daily values. Updating the daily values was meant to take place in order to reflect the most recent science. It was based on continuing to use the population coverage approach for vitamins and minerals. In doing so, we updated the daily value for total fat from 30% of energy to 35% of energy, which changes the maximum amount from 65 grams per day to 78 grams per day. In order to reflect that change in total fat, the percent DV from carbohydrate was reduced slightly, reducing it from 300 grams per day to 275 grams per day. The daily value for sodium was changed from 2,400 milligrams per day as a daily target to 2,300 milligrams per day, reflecting the most recent thinking of the IOM and to be consistent with dietary guidelines for Americans, as this reflects the consensus science that exists today. The daily value for dietary fiber, or daily amount for dietary fiber, was changed from 25 grams to 28 grams. To reflect the most recent review of the IOM around the daily requirement for vitamin D, vitamin D was updated to reflect the most recent IOM report, and there'll be a requirement in vitamin D to express those units in both IUs and in micrograms. Similarly, the IOM recently updated the daily value for calcium from 1,000 to 1,300 milligrams per day, and that change is reflected in the requirement for the new nutrition facts label. And finally, one of the new mandatory elements, potassium, the daily value was shifted from 3,500 to 4,700 by the most recent dietary guidelines, and that's the daily value selected for potassium. The general population approach uses the highest RDA for 4 years of age or older, excluding pregnant and lactating women, and this approach provides an intake level sufficient to meet the requirements for nearly all Americans, making sure there's coverage for between 97 and 98% of Americans to assure that they get adequate nutrient intakes. Next slide. As I previously said, the nutrients of public health significance have changed, particularly with those with some of the essential vitamins. Saturated fat, trans fat, and sodium remain nutrients of public health concern, and so they maintained on the nutrition facts label. Vitamin D and potassium are now mandatory on the label. Vitamin D is associated with a reduced risk of osteoporosis, and vitamin D intakes are consistently low in Americans, particularly in the winter months where vitamin D status declines greatly for many Americans. Calcium and iron will remain on the label as they remain nutrients of public health concern, as many Americans are not getting sufficient intakes of these important nutrients. However, Americans are now consuming adequate amounts of vitamin A and C on a regular basis, so they are no longer mandatory on the nutrition label, but can be declared on a voluntary basis. We've also changed the requirements for how these nutrients are declared, as I previously said. So not only do you need to declare these nutrients in terms of the percent daily value, but you also need to declare absolute amounts of the nutrients of public health significance. We believe that including the absolute amounts will be helpful to consumers who want to put public health advice that they get from registered dietitians, other healthcare providers, and doctors into effect. For example, many physicians will tell you to get 1,300 milligrams of calcium, and many healthcare providers will tell you to limit your intake of sodium to no more than 2,300 milligrams per day. So having the absolute amounts on Nutrition Facts Panel helps Americans be able to comply with these health recommendations that they're getting from many healthcare providers. Next slide. Trans fats. Just to remind you all, FDA took action in June 2015 to remove partially hydrogenated oils from generally recognized as safe, and therefore prevent them from being added to food products in the food supply. This will all but virtually eliminate artificial trans fat from the food supply, having the beneficial effect of reducing coronary heart disease and preventing thousands of fatal heart attacks each year in the United States. FDA has set a 3-year compliance period for removal of partially hydrogenated vegetable oils from foods, which is June 18, 2018. This allows companies to reformulate foods or to petition FDA for use of PHVO in certain circumstances as food additives. While companies have made strides towards reducing or eliminating PHVO, FDA has also received petitions requesting their use as food additives in certain circumstances, and we're reviewing those petitions now. In order to make sure that Americans continually get information about trans fat either from PHVO or from naturally occurring sources from ruminant animals and others, we feel it is necessary from a public health basis to continue to require trans fat labeling on the Nutrition Facts Panel. Next slide. In looking at dietary fibers and updating the regulation, dietary fiber in the past has been mostly defined by chemical measures rather than physiological measures. However, the public health benefit of having dietary fibers in foods is because of their physiological or health benefit that is beneficial to human health. So in updating the Nutrition Facts label, we're updating the requirement that dietary fibers that are added to foods meet a definition that they're physiologically effective in a way that's beneficial to human health. FDA will publish, as Dr. Main has already said, guidance that will provide the review of the number of fibers and the basis for how you define fibers based on physiological effect in the Nutrition Facts Panel. Some of those fibers that have physiological benefit are already disclosed in the Nutrition Facts rule, and some information about that can be provided in the rule. This will assure that Americans getting dietary fiber, whether they're naturally occurring in foods or whether they're added to foods, will be getting fibers that have physiological benefits to human health. Next slide. One of the changes in the rules are records requirements. This requires manufacturers in certain circumstances to make and keep records to verify the mandatory declaration of some of the nutrients in the Nutrition Facts Panel. For example, sugars, as well as certain fibers, vitamin E, and folic acid and folate, because analytical methods are not available for us to be able to determine the compliance of these particular declarations on Nutrition Facts labels. For the first time, records are needed to verify the declaration of mandatory nutrients, particularly if certain fibers are added. We feel that this record requirements will help FDA assure that the information getting on Nutrition Facts panels are in compliance with the rules. Next slide. I'd like to now move the discussion over to serving size changes. So in the second rule, we've updated the serving size regulation. It governs the serving sizes in food products. And just to remind you all that by law, serving sizes must be based on the amounts of foods and drinks people actually consume. We call this at FDA reference amounts customarily consumed, or RACs. As portion sizes that are available in supermarkets and people's consumption habits have changed, we did a thorough review of the data in order to look at whether or not there was a need to update serving sizes in many situations. Approximately 30 out of the 158 existing RACs will change. For example, bulk ice cream's rack will change from 1/2 cup to 2/3 cup. So that will have an effect, as you can see above in this particular target, that a pint of ice cream previously would have had 4 servings per container with 200 calories per serving. With the new Nutrition Facts Panel, a pint of ice cream will contain 3 servings per pint, and there will be 270 calories per serving, reflecting more of what typical consumers are consuming and providing them with better information about the calories they're consuming per serving. Next slide. As per the Nutrition Labeling and Education Act, serving sizes are calculated based on RACs, as I previously said. And approximately 30 out of the 158 RACs will change. Another change has been carbonated beverages. Typically, the rack previous to this had been 8 ounces, and the rack will be updated to 12 ounces, which reflects the more common portion size that consumers are getting in many ready-to-drink products that they're consuming every day. Another example of the change is yogurt had a previous serving size of 8 ounces, and it will be reduced to 6 ounces to reflect the typical serving size or typical container size of yogurts that Americans are getting in grocery stores throughout the country. In addition to changing of the 30 racks, approximately 25 new racks have been established based on petitions and the presence of new foods that require new categories into the food supply. So with this update in racks and serving sizes, Americans should be better able to determine the nutritional information for the serving sizes that they typically eat, helping them to make more informed choices. Another change in labeling of serving per packages is label of single-serving packages. Under our previous rules, 12-ounce and 20-ounce bottles of beverages could be labeled as 1 or 2 servings. Now that we know package sizes affects how much food people eat and drink, we're making some adjustments to single-serving containers. While the serving size for a beverage is 12 ounces, both the 12 and the 20-ounce bottles will be labeled as 1 serving because people typically drink both sizes in one sitting. So we're making a distinction in the new rule between serving size and serving for packages that do not exceed 200% of the reference amount customarily consumed. These changes will help consumers not have to do the math. They can easily tell when they're looking at packages how many calories they contain and other nutrition information for those packages, and be better informed about the consequences or that they have in consuming the products before them, helping them to make better dietary choices. Before this change, manufacturers could label the bottle as 1 or 2 servings at their discretion. This final rule helps to make sure that consumers get more consistent and helpful information about the products that they're consuming. Next slide. With the new rule, dual column labeling is now required on packages that can be consumed in 1 or multiple servings under certain circumstances. The nutrition information will be presented per serving and per package for packages that contain 200% and up to and including 300% of the rack. So for example, a 3-ounce or 90-gram bag of potato chips would be labeled per serving 1 ounce or 30 grams, and per package 90 grams. And the nutrition information for each of those will be provided clearly within the Nutrition Facts Panel. We believe this again helps consumers get information they need to make informed choices, and help guide them into eating healthier diet patterns by providing information per serving and per container, putting side by side, so again, they don't need to have to do the math, and they quite quickly can see the information that they need to be informed about their eating choices. Next slide. Compliance date. In the original proposal of the proposed rule, 2 years was going to be required for all manufacturers to comply with the new rule. In the final rule, this has been changed slightly. Compliance date will be 2 years for all manufacturers except for those with businesses of less than $10 million in revenue who will have 3 years to come into compliance. This additional year for help small businesses better comply or better give them more time to comply with the rule, as they will need more input and help in order to modify their packaging materials. And as Dr. Main said, we expect to issue guidance in the near future to help companies understand whether or not they will need to comply with the 2-year or 3-year compliance date, as many companies are not sure how to best determine their overall sales revenue. So we'll be updating guidance to help with that decision making. Next slide. As part of finalizing my discussions, I'd like to just emphasize we will be updating all of our existing educational materials to focus on the new changes, and we'll be working in partnership with other federal government and health professional agencies and manufacturers and retail and other nonprofit organizations to help develop more comprehensive educational materials to help consumers understand the changes and how to use the Nutrition Facts Panel. In addition to that, we recognize that the changes in the Nutrition Facts Panel and serving size will require updating of several of the elements of our nutrient content claims and some elements of health claims. And we'll be working through some of those changes. So we want to emphasize that as companies are looking at their food labeling, such as nutrient content claims, just be cognizant that changes in RACs and changes in the daily value will need to be taken into account when companies are looking at nutrient content claims such as good or excellent source of. As those simple changes are not based on the percent daily value and the portion sizes in the rule, any updates to the nutrient content claims regulations are not needed for companies to comply with those elements of those claims, but I just wanted to emphasize that companies will need to take that into account as they look at the changes in rack sizes and the changes in daily values. We'll also be looking to update some other elements such as the definition of FDA healthy. With that, I'd like to close this part of the discussion and open up this session to comments. So thank you very much for listening.
Thank you, Dr. Ballantyne. It's now time for our question and answer session, and I will ask the operator to open the lines and provide instructions for our callers who have questions.
Sure. If you have a question at this time, please press star 1. First question is from Shirapi Kapoor from Tata Global Beverages. Your line is now open. Please check your mute button. Your line is now open. Next question is from Valerie Fabro from Tops Company. Your line is now open.
Thank you. My question is regarding the current rules have certain exemptions for small packages and labels of a certain size. Will those exemptions be affected in any way by the new rules?
Well, we have exemptions based on sizes for various aspects. I think they may change one way in the footnote. That requirement changes because it will no longer be required for I'm talking about the packages in the that can use the linear display or the tabular display for small packages. But I can, if you email that question to me, I can give you the exact specification of everything that is going to change. That's just one that I know is going to change.
Okay, excellent. Thank you.
Next question is from Erin Gorman from Acme Foods. Your line is now open.
Hi. When are we going to be able to see the actual physical guidelines for what changes in the nutritional facts panel, like the font sizes, things like that? And also, where are we going to be able to access a list of the actual nutrition changes, the amounts of daily value?
So if you actually look at our final regulation, all that information is in the rule. There's a table in the rule of all the changes for the daily values. So I would recommend looking at the rule. We also have all the information on the font sizes in the regulation. One thing that we are planning to do, though, to help people, we know looking at the codified can be a little confusing, so we're planning to actually have some pictures of the nutrition facts label and have font sizes next to them, and also display some of the caveats that we have, because we definitely took feedback when we heard from stakeholders and made some exceptions, and we will have that posted sometime in July on our website. And it'll just be a pictorial or graphical, really a pictorial of the label with the font sizes to help people. Next question.
Next question is from Christina Phelps. Your line is now open.
Hi. I'm wondering if you have any timeline for when you will provide the guideline for submitting evidence to have additional types of fiber approved, and then kind of aligned with that, I'm wondering if you've heard from any foreign governments feedback about the change in the rules, especially the definition to fiber.
So for the fiber, we're working, that's a priority for the agency, and we're working on that guidance to come and publish soon, and that guidance will have information on fibers, the research out there that's publicly available on the fibers, as well as guidelines for companies to submit information. And it's actually going to be 2 separate guidance documents as well.
2 separate, no, this is
for foreign countries, I'm not aware that we've heard anything from any foreign countries regarding fiber.
Have you heard from foreign countries regarding other topics?
Yeah, I was going to say in the proposed rule, we've received a lot of comments from foreign countries. Then that's actually publicly available on our docket.
Okay, thanks.
Next question is from AFC Sushi. Your line is now open.
Hi. I was just wondering if there was a % daily value, like a reference for the added sugars. It's not listed on the PowerPoint.
You're speaking very softly. Can you repeat that question for us, please?
Is there a % daily value, like a reference for the added sugars?
Yes, so we established a % daily value for added sugars of 10% of calories, which is 50 grams for foods that are for children 4 years of age and older and adults. And for children that are between the ages of 1 through 3 years of age, the daily value is 25 grams.
Okay. Thank you.
Next question is from Mark Cardell from Atkins Nutritional. Your line is now open.
Yes. My question is in regards to the record keeping, specifically related to the databases that we are allowed to use. Are we going to be able to use programs such as Genesis without analytics, or are they going to have to use them together? So that's kind of where we're wondering.
not exactly something with Genesis specifically, but if that program and that database can output the exact information that is needed, essentially the amount of added sugar per rack for that particular food, then it would likely be considered separate. But it all depends on what specific information that could output.
I mean, but we're not even looking specifically just for added sugar. This would just be holistically to ensure that our nutritional facts panels are accurate. You know, can we use a database program solely like that, or does there have to be the backup and record keeping of analytics on the side?
If you're using that to substantiate the amount of added sugar in your product, then you are taking on responsibility for that the information in the database is accurate, and we will be looking at that information and use that information as your validation, and I guess that's all I can say.
If you have more specifics, I would definitely recommend that you can put the information in an email and email us.
Understood.
Next question is from Denise Hines from Crown Prince. Your line is now open.
Thank you. You answered one of them about the size. The other one is you said that you're working on some various compliance information. Do you know when that will be published so that we can take that into consideration with all the other things that we're working on?
Hey, this is Claudine Kavanaugh. For the compliance, that's a high priority for the agency, so we're actively working on it, and we hope to get it out as soon as possible, but we unfortunately don't have a specific date.
Okay.
Next question is from David Hands from ESHA. Your line is now open.
Yeah, I had a couple of questions. One was about the documentation when some of the nutrients can't be, you mentioned in the talk, can't be analyzed directly, like the physiological benefit of fiber. What kind of documentation are you looking for? Is it another, if you can't get the information from a lab, are you just looking for documentation that you believe a certain percentage of the fiber is bioavailable? And how are people going to be documenting this?
Yeah, I was going to say maybe, Blakely, can you answer for like added sugars, give that as an example?
Yeah, for dietary fiber, when there's a mixture of fibers that have a physiological benefit and that don't have a physiological benefit, we're requiring manufacturers to make and keep records of the amounts that have no physiological benefit. And in the final rule and in the proposed rule, we had various examples of the types of documentation that you could make and keep to verify that information that could include chemical analysis. You know, there's lots of batch records, there's lots of different examples, but we don't specify. We kind of leave that up to the manufacturer because they're best able to determine what kind of documentation they need to verify that information.
Okay, so it is something that a laboratory or a database could collect as far as bioavailability.
I can't answer that.
Methods.
Unfortunately, our fiber expert isn't here, and I can't answer that specifically about the bioavailability in a database.
You're talking about issues such as bioavailability generally in the guidance that we plan to issue. But again, I will say that the issue on the record specifically in bioavailability, I think, again, with the benefit of the later guidance, you'll be able to look at that and look at the rule, and then, as the earlier FDA representative noted, make some decisions about then the records that would be appropriate.
Okay. And one quick question that the doctor mentioned on the hairlines for added sugar being indented below total sugar to indicate that it's a subcomponent of sugars. In the card deck that you showed, the first example label indents saturated fat and trans fat hairlines below total fat to indicate they're a component in the dual column example, but it doesn't indent them in the first example. So I'm wondering if there's going to be a consistent preference to either indent the hairline so that they indicate they're a subcomponent, or to not indent the hairline so they're not a subcomponent, because the two examples are inconsistent.
There will be the hairline changes only for added sugars. It's not for saturated fat and subcomponents of the total fat, like saturated fat and trans fat.
Okay, so in the dual column example, they're not indented, but in the added sugar example, they are.
This is Jill Kabbalah. Are you talking about the dual column display that's actually shown in the codified of the final rule? Yes, that is a mistake, and that can be fixed at another time. But it should not be indented, no.
All right, thank you.
I think we have time for one more question.
And the next question is from Mark Kassab. Your line is open.
Hi, my question is specifically kind of along the lines of the fonts and the font sizes. I've gone through the rule and I see where some of the font sizes have specific point sizes and it says it's a regular font. Is there a specific type of font that needs to be used, or can we use any kind of standard font?
You could use any type of standard font you like, but I mean, we do have in the codified currently an Appendix B that has a depiction of a nutrition facts label that provides some guidance for you there. And I mean, Helvetica is one that's used in Gothic Black, but again, I mean, it's not specified in the codified. That you have to use.
Yeah, I just wanted to make sure because, as well as the font type for the hairlines or the line breaks, is there a specific millimeter height that we would need?
There's no requirement on the thickness of the line.
Okay, I just wanted to verify that. Thank you.
I want to thank everyone for joining our call today. Again, remember that we have the email box in case you have additional questions that you can email nutrition program staff at fda.hhs.gov. And we look forward to working with everyone to help them implement the updated nutrition facts label. And I want to thank everybody for their time, and we appreciate all your questions today.
Thank you, and that does conclude today's conference. All parties may disconnect.